If somebody fractures a hip, then in that 1 year where they had that hip fracture, it's a 20% chance of dying. I mean, people are on 10 medications, 15, 20 medications, right? Like I see a whole list and I'm like, oh my goodness. And then you have all these interactions between different medications and you feel even worse. So yes, I would say first you should start on, is there something that you can change in your diet or in your exercise regimen that could potentially help your pain?
Dr. Neha Bhanusali,
triple board certified physician,
and an award winning educator.
and one of the most sought after voices in aging and bone health. Also, I wanted to know, like, people around me, what I've noticed, like, people who are obese, they generally end up going for knee replacement and hip replacements.
When you gain a pound of weight, how much extra pressure do you think that is on your knees, Hitachi? Just take a wild guess.
If more, maybe two.
But actually, if you gain 1 pound of weight, it's about 4 to 5 pounds of pressure on your knees, right? So it's like an exponential amount of pressure. So if you gain, and let's say on average people gain 10 pounds, right? That's 40 to 50 pounds of pressure that's now added on your knees, right? Your knees are still the same size, so how can they work around that? Everybody has their own unique story. So I think it's also very hard to talk about this. I'm very passionate about it and I talk about it.
Hi, Dr. Neha. Welcome to the show. We are so happy and excited to have you. And I'm sure that our viewers are going to love this podcast because you will be talking about aging and bone health and what works and what doesn't. So many times when you're aging, you have thousands of questions in your head, what to do, what not to do. And so I will also try and put up few questions which I think people around me, my parents, and are facing these issues. So I will request you to guide us on the same. So the first question that comes on the top of my head is it really possible to work on your bone health when you have reached your 50s and 60s?
It's a good question, actually. So I do get that. When people meet me, they're like, can I do anything except medications? Like, what can I do, right, and change in my life? So I would say I wish you had started in your 20s and 30s because that is the time for when you can gain your peak bone mass. So if you have children, if you have loved ones that you need to tell it to them that they should start young. But it's not too late when you reach in your 50s and 60s by any means. I think anything can be improved upon. And I would say that there are building blocks of bone that you first need to put everything into. You need to put the right nutrition into them, the right minerals and vitamins into them, and you also need to move. So when I say that, I'm saying if you're in your 50s and 60s, if you're, for example, a woman, right, after menopause, there is certainly this reduction in bone density that can happen. But it's not just women, it's in men too. And we often ignore men and we don't think about it, but they also can have hormonal imbalances or nutritional deficiencies. And so, what I mean by that is, there are people that have sensitivities or maybe allergies to certain food. For example, something like gluten, right? So if you're somebody that has a lot of GI discomfort, some bloating, gas, and especially if you notice it's with certain foods, it's worth trying to find out if it's something that you're consuming that could be bothering you. Because actually, it's not so simple as you can't tolerate it. It may be something that it causes something like inflammation in your body. And because of that, maybe your bones are not as strong as you'd like them to be.
Oh,
So
that's an insight because often many of us do not relate inflammation to that level that it can also have impact on our bone health as well.
yes,
So
no, absolutely. It's all about inflammation, right? It's all about whether you have subtle levels of inflammation or you have very obvious levels. When people think inflammation, they think of conditions like I'm an autoimmune specialist. So usually my patients are thinking of things like rheumatoid arthritis, lupus, there's different autoimmune diseases, but actually you don't need to have all those diseases to have inflammation in your body. You can have just even low levels of it, low-lying levels of it. And that can really impact your health, your bones, your muscles, and all of that.
So, what is safe level of inflammation in our body, and beyond which, what level it is something that we need to get alert.
Okay, so that's actually very good because people think of inflammation as bad. So I'm glad you brought that up. It's not all bad. We want to have, if you get hurt, right? You go out right now, Hitanshi, and you fall and you scrape your arm against something, right? You're going to have a cut over there, maybe a bruise. So you're going to have some inflammation, and that's good because you want it to heal. You want all the blood cells to rush to that area and kind of repair it, right? So if you didn't have some inflammation, it wouldn't happen. So you need that to happen. And the problem is when that inflammation is taken care of, but then you have these low levels of inflammation that are kind of continuing. They don't hurt as much. So when you got hurt, right, this is painful and it may be red, hot, swollen, tender, right? You see it. But then you have people who have low levels, chronic inflammation is what we call it. That doesn't hurt like that acute inflammation stage. And that's what we don't want. We don't want chronic inflammation. So yeah.
Okay.
It's okay to have some, but you want it in
Yeah.
the right place at the right time and not anything
Yes.
beyond that.
Yeah. Right. So that's quite helpful. That inflammation is not always bad. How would a common person would get to know, what are the common signs that that I will get to know that my bones are not that strong, or they are losing their bone density, apart
Mhm.
from going into the test? And if tests, then what are the tests that one should go for?
So there are some early signs that you can look at. You may know somebody like this where you've known them for many years, and all of a sudden you're looking at them and you're like, you look shorter than you used to look. You know, there's a definite height decrease. Now, a little bit's allowed, like up to maybe an inch. You know, you can, as you get older, your disc spaces can change a little bit, and our posture can change, right? We might be slouching more and just, a little bit different in our body habits. So that can happen. But if you're hitting over like an inch and a half and there's a difference, your clothing is just looking longer than it used to, and it's not the sizes outside that's changing, then it might be that you actually are shrinking. And that is something that's concerning, right? Because you're wondering why is all of a sudden this height difference happening? And it could be something like bone loss, especially in your spine. So in your spine, you have all these lovely vertebrae. They look like this, or nice and stacked, right? And when we're young, they should be robust, they should be full, all of that. And as we get older, you can get something called compression fractures. So you have these lovely, vertebra, but then there's a little compression, right? You can have multiple ones of that. And because of that, you start going like this, and you start leaning over. And the problem can be like when you have that, we call it kyphosis. So you're slowly bending over. So now there's not enough room over here for your lungs to really even take a big breath sometimes. Your breathing can change when that happens. And so you may even get a pulmonary or lung problem because of this vertebra that are kind of getting smaller, that are compressing. So it really affects you, and you look shorter. And then you get that hump. Have you ever seen anybody that they look like their back, they have this little hump in their neck in that area, and that is all from these compression fractures. So you can visibly see these signs of it. So that's good, but there's also other signs, like for example, your dentist. You go to the dentist for a cleaning, and they're like, oh, your jawbone is looking weak. We hear that all the time, and somebody comes in, they're like, my dentist said, to come see you that there is some receding jawline. I'm having some bone loss there. So that's another way you can catch it, actually. And then
Wow.
yes, I know it's like, the dentist could be the first person to even discover it. But another thing is, let's say you're walking, right? And you walk off a curb, right? And you fall down and you break something. Should you have broken that? The question that I usually ask my patients is, if you were 22 years old, would you have broken that the way you fell? Now, sometimes you have bad fall, right? You're going to break things. But sometimes it's like, no, if I was younger, I probably would not have broken that. And that's when you should be like, wait a minute, maybe I should go and get checked for my bones and how strong they are. So yeah.
Okay. So that's quite interesting. One is through your jawline, other is through the spine or the height that you have. And the third one, if in case you fall and you get fracture and you think that you would not have got it when you were much younger.
Hmm.
then you should be little alarmed about it.
Yeah.
That you need to work on your bone health.
Exactly. Like if you fall from a fourth story, building, yes, okay,
Obvious.
it's obvious you might break something. But if it's like you should not have broken it, it was such a mild fall or something, then yeah, you have to look into maybe why. And you had asked me like what testing you would get done. So usually after menopause, for the most part, if we're concerned, the insurance will cover something called a DEXA scan, a bone density scan. And it's not long, it's not any crazy sounds like you get an MRI machine. It's actually very easy to do. It's just like this little wand thing that goes over. The good thing is if, insurance doesn't cover it, it's actually fairly reasonably priced compared to some of these other tests. So if you were worried and they didn't cover it, you could get it done. It's not as big a deal.
Okay.
So it might give you an answer of how thin your bones are. Yeah.
Yeah. One more thing that I was thinking, like, I know few women in my family and my friends' parents. Um, like this, they have got this fracture. Like they have just missed their balance and fallen from a stair, not multiple stair.
Hmm.
Twist their foot and they finally got fracture. Would something like this be also be sign of weak bone health, or it could otherwise be there?
So if, like, for example, it was a woman after menopause, certainly I would check a bone density in that situation.
Okay.
Yeah, it could
Okay.
be like it could just have happened and you're just unlucky. But especially if it was more than one time and they broke something, certainly I would check. And then you don't want to forget people that are younger than menopause, right? Like they also can have these problems. And a lot of time people don't catch the bone loss until it's too late because you figure, okay, they're young, it's probably just a fluke. But there are people that have different deficient nutritional deficiencies, or they have some other problem that could be causing it. Like they might be taking a lot of steroids. Let's say they have asthma, and they have to keep taking all these oral, pills, these steroid pills, or even like, even inhalers with the pills, all of that can really contribute to it. Somebody has rheumatoid arthritis, certainly that itself is a risk for having lower bone density. So even thyroid disease as well.
Wow. So these two, I would say, more than rheumatoid arthritis, having a breathing problem, um, it would be something which is very common when you age. And plus,
Hmm.
so you have related it in two ways. One, that when your spine starts shrinking, that also impacts your breathing, right?
That can, yes.
And then when you are facing these breathing related problems, you go more on these steroids and all. And that also has an impact on your bone loss. Okay. So
Hmm.
you kind of get into that vicious circle, right?
Hmm. Yeah, absolutely. Absolutely. Yeah,
Okay.
there's definitely a circle that can be done there. And then, sometimes, people go to straight to the orthopedic surgeon and they've broken something, right? And they don't know what their bone status is, if it's thin or it's not thin. And they go there and then there's all this trouble, they get it fixed and there's all these problems healing. It doesn't heal well because they have all this bone loss. So it's kind of important to know, because you also want to know how your healing will be. Sometimes, the surgeons will say, tell your doctor, your bones were kind of crumbly. They're just not good texture. We just want stronger bones first before we do this other operation. Like I have patients, I know one that desperately needs to get her hip replaced. Like it's really bad. But because she has such severe osteoporosis, the surgeon doesn't want to touch her. He's like, you're not going to do well with this hip replacement because you need to really strengthen your bones first. So yeah, we're doing this whole, it's going to take about a year and a half to get really probably where we want to be before she can get it done. So it does
Wow.
impact you, yeah.
Wow. So, what I see around like hip replacement and knee replacements are quite common. So, it would only be successful if you have good bone density. Is that what you mean by this?
So in some cases, sometimes they're fine. They can put it, put the hip back and they don't really have any problems, any complications, and it heals well. And there are other cases when you have severe bone loss that, yeah, they have a hard time actually with the outcome of that hip replacement. And something else to know is that if somebody fractures a hip, well, two things that I want to say. If somebody fractures a hip, then in that 1 year where they had that hip fracture, it's a 20% chance of dying, actually. And it's like, the surgeons are good at putting that hip back together. They're well trained. It's a very common surgery, like you said, that's done nowadays. And yet people are still dying after having a hip replacement, because they're lying in these beds, they're losing muscle mass day to day because they can't move, they have to do aggressive physical therapy. But all of that comes along with that, there is a high chance of mortality or death when you have a hip fracture. So you want to try to avoid it. And one of the things that we didn't talk about is if you are worried about bone density and it's something that's, occurred to you and you know that your parent has broken a hip, that is itself a risk factor for having lower bone density or osteoporosis. So it's good
Okay.
to get checked if that's something that's a concern.
Oh, well. So that was quite insightful. So, would you recommend people before going for hip replacement or anything, get yourself checked? And I think the doctors would get them scanned for their bone density. And also, it makes sense to not go to that level first of all and start working on their bone health already before it's too late, because the risk is too high. As you mentioned, that 20% of people die, even
Yeah.
if well, everything is like fine, the doctor is fine, the surgeon is fine, but still, this is what data talks about.
Yeah. It used to be higher. So this is actually a pretty good number. It was much higher than this even.
My God, that's really scary. That's really scary. So
Yeah.
also you mentioned that physical therapy. So that plays an important role.
Yes. Because, it's the physical therapy is also helping the muscle that's around those joints, right? So when we talk about bone health, but we didn't mention muscles. And what holds those bones nicely in place is all your muscle, your ligaments, all the other areas. So if you don't work on those, then that muscle loss is also not helping the whole picture with the bone loss, right? So you have to work on both of them. And the best way to do it is really movement. So when I talk about what different exercises that can be done for like bone loss, we talk about weight bearing activity. And what we mean by that is anything where you can like kind of pound your legs against the ground. You don't have to go for a run or a jog. Most people who have osteoporosis or osteopenia probably aren't jogging. So you don't have to do
Oh,
that. But yeah, so I mean that's a good exercise, but they're not doing it. Jump roping is fantastic, for increasing bone density. But even just walking, you can just walk, and that is also a good exercise. Swimming isn't the best exercise. It's so good for so many things, but for building bone density, it would probably be a little bit lower on my list, and you'd want to
mhm.
do kind of more where you're pressing your bones, down, kind of like walking or speed walking or running. Those are still better exercises. Yeah, no, I would say most of the people I see are not runners who have osteoporosis. Most people are
Mhm.
not exercising enough, to be
Ah,
honest. That's one of the problems, and so like you were saying, how can we still improve bone health? Number one, you have to have the will to do that because I see patients, right? I'm practicing as a physician, and sometimes when they get these results and we talk about them and they say, what can I do, to improve my bone health? And we talk about different weight-bearing exercises that they can do, improve their calcium, vitamin D intake, their nutrition. We talk about all that. And then I may meet them again 6 months or 12 months later, and they're like, yeah, I meant to do it, but I have to be honest, I haven't really done it. So I
ah.
do hear that quite a lot. So yes, you have to have the will to want to do this, but you can improve all of this. There has to, you have to do it though.
So you're saying working on the mindset is the first thing that one should start with to be able to do the other things. Until unless
Absolutely.
there's a mindset shift, there is very less probability, irrespective of how good. So you may be visiting the best doctor of the country, but it won't work until unless there is a mindset shift. It's you who have to
Exactly.
start working on it.
Yes, yes. The doctor can't make you get off the couch. That part has to be the patient, right? So yeah, because we have medications, but I think I'm also board certified in lifestyle medicine. So for me, if you can use parts of your life, if you can do something on your own to improve things and not just depend on medications, that's my preference. So if people are borderline, it's not that bad, then usually I'll be like, okay, if you want to try, changing all these things in your life, let's go for it. But, a lot of times people say they will and they just don't. And then I meet them, we retest them, and it's like the decline has happened even further. So yeah.
I also agree with you completely on this, because I have also noticed that people around me and a lot of people that I've worked with, so a lot of people need hand holding, or maybe I would,
Mhm.
in my experience, what I've noticed, it makes sense to enrolling for some practice and activity, for one to be regular, because
Mhm.
it doesn't come from inside for a lot of people. So when you enroll for something, you pay for it or you commit to it, the chances of you showing up, or if you know that's a plan, or for people who can afford and really, that is not something exercising or physical therapy does not come to them naturally, then uh, someone coming to them and
Mhm.
getting them to do practice would make sense. And I feel that it's like an investment. People generally feel that that it takes a lot of money, and but I feel in the long run it would save a lot of money for you if you invest in physical therapy or any
Mhm.
sports or any exercise routine.
Yeah, I agree. And it's a person, right? It can be very cheap. You can just buy your own barbells, you can buy some weighted vest, and you can get some ankle weights, and you can get started. But you're right.
Yeah,
Some people need to pay into something, be held accountable for it, and there's nothing wrong with that. If that's you, you go for that. You can do it either way, but there's so many ways to do it, right? If you have that will, then I think that you can approach it in so many different ways.
correct. So I would also recommend like going for a group or such sessions, because many times as you age, you also lose that interest or to work on yourself. But when your social life also improves when you go for these classes, so
Yeah.
then your desire to live or to be healthy, that also is taking care of the mindset shift that you were talking about.
100%. And I think that's a great point, like the social connection behind it. If you're in your 50s and 60s, which is what we're talking about today, it's your kids might be out of the house, right? And so you need something to do. You might be moving, you may be in a different spot, maybe your friends have moved away, and you need that connection with other people. I think the gym or just even pursuing these activities is just a great way to get it. So yeah, two birds with one stone.
Yeah, true. Okay, so you also mentioned about swimming, which is quite, which I was not aware of, because swimming has always been put as one of the best exercises. It's like for the respiratory, for muscle, for everything. But so why do you think swimming is not actually there for improving bone density?
So it is a wonderful exercise, and that's why I don't want somebody to just stop doing that if they swim, right? Because it helps so much in your body. Like you said, all of the organ systems that you've named, and muscles, ligaments, all of that. As we get older, we lose muscle mass, right? So that's number one.
Mm.
After the age of 30, every decade, about like, 3 to 5% muscle mass loss. So we have to upkeep that. And if you can do that through swimming, that's fantastic. One day you may be reaching into a cabinet, and pulling something out, and you're like, this hurts, right? Because we haven't been working on those muscles, those paraspinal muscles and all of that. But with bones, specifically for bone density, it is more weight bearing exercise that's going to give you more out of that. You can still swim, even bicycling, people do recumbent bike, like leaning back. They're not really putting that force into the bicycling, right? When you're doing a recumbent bike. If you're outdoors, and you're using a bike, that's still a little bit more force. So I like that a little better, but it may not be safe wherever you live to do outdoor biking, and you may not be able to do it. So that's okay. You kind of have to work with what you have, but there are different exercises certainly that are better maybe for bones than others. And yes, and we were talking about before about going to a gym, definitely there are machines and all that are better for weight bearing exercises. Around me, there's been opening up a lot of these kind of osteo osteocomplexes, like gyms that are specific for osteoporosis, osteopenia.
Oh,
You can go to
wow.
them. yeah, I don't think you need to go to them, but if that you feel more comfortable, because those people are trained on certain exercises that are going to help improve your bone density, right? But you can go to a regular gym. You don't have to do that.
Well, well. So any like any top three? I know it's not just one exercise or top three exercise, but
Mhm.
would you like to name any top three or four best exercises that if you are post 50, then you should be practicing these?
So movement is, first of all, the most important thing. Whatever you can do to move is going to be
Yeah.
my number one. Okay.
Mm.
I would say walking is one of the best things, after your meals, it's a good idea. Just get up 10 minutes at least, just walk around. Don't just sit down and stay there. And walking is a weight-bearing exercise. Now, if you want to get a little bit more out of that, throw on some ankle weights, give yourself some resistance when you do it. Because if you're going to go out for a walk anyways, you might as well get more out of it. So throw it on. The other thing you could use, and a lot of people are starting to use, is the weighted vest that I had mentioned before.
Mm.
But I do want to point out
Correct.
that you should be careful because if you have osteoporosis, specifically in your spine, people cannot handle so much spinal loading exercises. So you do have to be careful if you're wearing a weighted vest. If that's where your area of problem is. So it's a good idea to kind of talk to your practitioner and be like, all right, well, I have osteoporosis. Where were the worst areas? They really only measure the spine and the hips, even though you can have low bone density in other places. That's generally what a DEXA scan, measures. So you might want to be careful about that. But there's
Okay.
so many. There's calf
Yes.
raises that you can do. Those are also very good. You can do jump squats. Squats, I love squats in general. It's a form of exercise. And if you want to do
Same.
a little bit more, yes, if you want to do a little bit more because you want to get some bone strengthening, you can do like a stomp squat, just stomp your feet down and do it, or a jump squat. But of course you have to watch your balance. Balance is a big part of this, because as we get older, little things kind of get off, whether it's inner ear problems, whether it's your vision. Right now, you need glasses or you need a change in vision. Even hearing loss, subtle hearing loss can start around then. And that can throw our balance off, right? So you're more prone to falling in general. You don't usually walk down the street and just break something, right? You're walking down the street and your balance is somehow off and you fall, or you hit something, and that's how you break it. So that's why I'm saying balance is so good. And balance training is an actual thing that you can go to a physical therapist and they do just balance training with you.
Oh, oh. So, so you're triple board certified. Would you like to mention more about it to our audience?
Sure. So I'm board certified in internal medicine as well as rheumatology, which is the field of autoimmune diseases, and also more recently lifestyle medicine. So, and the reason I did that is because my field of rheumatology, I mean, we have a lot of conditions that we treat, these immune conditions, and we have a lot of amazing medications that are out there for them, which I'm very grateful for. But there is so much more than just medications, right? There's hardly people that will take a medication for a condition and feel 100%. They don't. They feel better usually, but maybe not as good as they want to feel. And that's where I think so many components that we don't ever talk about, they kind of come into play over here, right? Whether what we eat, what we put into our body is so important into how we're going to feel and what conditions we have and how we can improve them. And then exercise, is a really big part of it. My grandfather-in-law just passed away and at 102. And so
Wow.
longevity is important, but I think the most important is that you want to be healthy if you're going to live long. You don't want to just live long and not be able to do anything, right? So I think that is so integrated and integral in something we need to think about as we get older. And sleep, we don't often concentrate on that, and our lives are so fast paced nowadays that we don't think about that. But all of this really does feed into how you feel. So it's important. Yeah.
Yes, it is. It is. Also, I wanted to know, like people around me, what I have noticed, like people who are obese, they generally end up going for knee replacement and hip replacements more often. I don't know. It is not backed by any data study. Just speaking from what I have seen. So, does obesity has any impact on your bone and joint health?
So yeah, absolutely, it does. more recently, the studies are showing that fat itself causes inflammation, right? We were talking about inflammation before. So yes, the fat can cause that. But if we're just thinking just plain old mechanical point of view, right? When you gain a pound of weight, how much extra pressure do you think that is on your knees, Hitachi? Just take a wild guess.
If more, maybe two.
Okay, so that's a good guess. So you think that if you gain 1 pound, it's about 2 pounds of pressure on your knees. So
Correct.
no, that would be great if that was the answer. It wouldn't be that bad then, I guess. But actually, if you gain 1 pound of weight, it's about 4 to 5 pounds of pressure on your knees, right? So it's like an exponential amount
Wow.
of pressure. So if you gain, and let's say on average people gain 10 pounds, right? That's 40 to 50 pounds of pressure that's now added on your knees, right? Your knees are still the same size. So they're carrying all this much more weight,
Correct.
right? So it makes sense, right? That they have to do so much more than they used to have to do before in carrying that weight. But the good news is, so if you lose just even 5 pounds, that could be like more than 20 pounds of pressure off your knees. So at least that's good. Even if you lose a little bit of weight, that really helps. So mechanistically, you can see more weight. Yes, there's more going to be potential degeneration on your knees and kind of the hips, the whole lower part of the body. And then, like I said, fat itself is considered a part of inflammation. So there is a big tie-in, especially with inflammation and how you feel when you have excess fat, right? Because we all need fat. You have to have fat on your body. The question is how much fat, right? How much further from that ratio do you need to go? And that's where we need to be careful. So yeah, I would agree with you. There is generally more often issues, but you don't have to become like super thin or anything like that. It's just kind of coming down. So whatever's in a healthy range for you.
So, would it make sense to check your diet when you have started noticing your joint issues to work on them? As you said, when you offload it, then the effect that it has, it's not just in the same ratio, but in multiples.
Mm, so check your diet, meaning like change your diet.
So
You're saying, are you changing your diet?
yeah, to change your diet, to reduce, to have more nutritious food, and cut off junks and all those stuff from your diet.
Absolutely. You know, like I said, I'm always here. I have lots of medications. I don't know that you want to take all of my medications, right? You can easily go to the pharmacy nowadays and get some medication, painkillers, and all of that. But the first step when you start having pain in your body is to figure out why. What has changed? And is there something that you can do that's fairly easy? Like just think about the food that you're putting into your body and see if changing that can help reduce kind of those aches and pains that you're having. It may or may not. And if it doesn't, then you have to go get seen anyways. But unless you want to be on all these medications, because I see this, I mean, people are on 10 medications, 15, 20 medications, right? Like I see a whole list and I'm like, oh my goodness. And then you have all these interactions between different medications and you feel even worse. So yes, I would say first you should start on, is there something that you can change in your diet or in your exercise regimen that could potentially help your pain?
Earlier, it was like this, that doctor would only prescribe a medication. But uh, now, in recent times, the things have really changed. The doctors are now advising you to make lifestyle changes and not just depend on medication for you to heal, and take it as support system. And that's what I'm seeing, that right now here you are also advocating the same thing. Like, how many doctors are actually taking this up? Or is it still very few numbers of doctors who suggest lifestyle changes and, yeah, lifestyle health or lifestyle medicine things?
So I think not that many are still recommending it because it depends on two parties, right? So number one, the patient has to be willing to hear this, right? That a lot of people just want that pill. They just want to take the pill and be like, I want to take it for my blood pressure. I don't want to change my diet. That is hard to do. I would rather take the pill. So first of all, people have to be ready to hear this, right? And on the other
True.
hand,
True.
and we are both in different healthcare systems. And I don't know how
Correct.
it is over there, but I know here, you know, in our healthcare system, you get like 10 to 15 minutes to talk to somebody. And in those 10 to 15 minutes, how can you say change your entire lifestyle up and down, right? It is hard to do that because there's people want to know how and how does it reflect on them? And they may have issues in that they can't do it because of their circumstances. They're working, 12-hour days. They have children. They can't make their own food all the time. They just don't have the time. So how can they work around that? Everybody has their own unique story. So I think it's also very hard to talk about this. I'm very passionate about it and I talk about it. But at the same time, I also prescribe all these medications because people need the medications and they should get them. But the goal is to maybe take as little as we can get away with, right? And to try to use other areas that we can to fix it. Now, I also don't have time to spend an hour with each patient. I would love to do that. That would be the goal. But I work in an academic practice and I see a lot of patients, right, with these autoimmune diseases. So what I've done is I've created a YouTube channel and I talk about
Yes.
yeah, so I talk about things that I can't talk about in those 15 minutes, right? These are like, I want you to know this, but I cannot do it during an appointment. So that's why I've created a different way that I can teach my patients, right? I'm like, this is the questions that you want to know, but it's not always easy to get these points across. So I think Hitanshi, both sides, we have to be willing as patients to hear this and act on it. And then doctors also have to be willing to talk about it. So there has to be both parties. You're right, it's not super
So
easy
true.
yet,
So,
but it's
yeah, yeah.
improving. It's improving at least.
Great. At least the journey has started. I would put it this way.
Yeah,
So
because if you had met me like, when I started practicing 15 years ago, people did ask me back then, what can I change? What can I do differently? I don't want to take this medication or I'm taking so much of it. Can I reduce it? And I'm like, no, just take your medication. Because at that point, there was no data anywhere. There was no good research to
true.
say this, you can do this and that will help your symptoms. You can follow the Mediterranean diet and that's been shown to reduce symptoms of inflammation in rheumatoid arthritis. We didn't have those studies, but now that we're having them, I think we need to talk about them.
Good, great that you have come here and talking about it. And I would request everyone to please follow Dr. Sneha's channel. We have been hearing her, and she is awesome. So if you want to know about things more in detail, then please go ahead and follow her channel. I will be placing the link in the description box below. So, Neha, have you, in so many years of practice or recently, have you seen any specific case who has given up certain food group and now you have noticed there is change in their bone density for good?
That's a good question. Actually, so this week I saw a gentleman, and I know we don't often talk about men with osteoporosis. It's fresh in my mind because I just saw him in follow-up, but he's in his late 50s and he was sent to me by his primary doctor because they're like he's a male and they found he had this low bone density after he fractured one of his bones and so after he fractured one of his bones. And so they said, why is this guy having all these fractures? And is there something else that can be fixed? And so I said, sure, send him over. And we had gotten a bone density, and he was severely osteopenic. He was not osteoporotic yet, but he was on his way. And so we spoke about it. I met him about a year ago, and we talked about kind of his background, his diet, his family history, and I couldn't find anything. And I checked all of these blood work, between calcium, magnesium levels, parathyroid levels. I did a thorough workup. The one thing that he had was excessive alcohol. Actually, he did imbibe quite frequently, on a daily basis, and he had been trying to cut down, but it really hadn't happened. And I guess nobody has told him that it could affect your bones. Because when you think of drinking a lot of alcohol, people think of liver disease, which is true. You can get liver cirrhosis and all of the other conditions with that, but you don't really think about your bones. And so we talked about it, and I said, listen, he wanted to play with his grandchildren. He had a new grandchild, and he's like, I have to be able to pick them up. I can't be breaking my bones all the time, and I will do anything to kind of improve this. So we came up kind of with a regimen. He did do a lot of weight bearing activity, right? He was out there, very physical job, and he's still able to do that once, he healed his fracture. He pursued that, but he did not cut out alcohol. He still does drink, but he actually reduced it tremendously. I think I mean, I would say he's only taking 10% of what he used to take. So he does drink a little bit, but still, it was a big change in his life. So he increased the activity. He cut down on the alcohol. He did become more into clean eating. By that, I mean, he reduced the processed foods. He still enjoys food, but he kind of shifted it. So he reduced the processed food. Him and his wife are cooking more of their food. And he came back, 6 months, he was doing okay. We did not repeat a bone density then. It's really too soon, to see that change in the bone mineral density. So we repeated it at a year mark, and I will say it did improve. He's not in the normal
Mhm.
range by any means, but it improved within osteopenia. He's just mildly osteopenic, so we are not going to start any medications for him because this was kind of the test that was going to determine that. He also hasn't broken anything more in the last year. And overall, he's doing just fantastic. So, yeah, it can make a difference. Absolutely.
We had a good chat. But what are the final things that you would recommend our viewers to finally do every single day, or at least 3 times or 4 times a week, to have a healthy bone density in terms of diet, in terms of exercise, and in terms of basic lifestyle?
That's great question. So first thing I would say, look at what you're eating. Are you getting enough of the building blocks of bone, which are calcium and vitamin D? Vitamin D is tough, right? So even I live in Florida. It is hot, and yet we see so much vitamin D deficiency, right? So vitamin D levels are easy to get checked, and they're pretty easy to supplement, if you're not having appropriate levels. Calcium, I like it better when you get it in your diet because there are some studies that are showing that maybe people are taking too much and it could affect their heart.
Mhm.
And so if you're getting, and it's surprisingly, it is not that hard to get in your diet. People think only of like milk and cheese. And yes, they do give you a lot of calcium, but there's so many foods out there that do. It's really easy actually to figure out according to your own diet. There's a calcium calculator that you can do online. It's in one of my videos, it's a calcium video. And it's very easy. You just like write down, okay, 3 times a week, I eat this pasta. Twice a week I eat pizza, once a week cheesecake, whatever it is. And then at the end, you press calculate and it tells you how much you're getting in a day on average. So it's actually pretty easy to calculate. So number one, you have to get the building blocks for your bones. Number two, you have to move. And you have to move 3 to 4 times a week is what, Hitanshi, I think it's important, but really, you need about a proper amount, let's say average of 30 minutes a day, 5 days a week of appropriate aerobic activity. But you also need 2 days of about 2 days of strength training. So that a lot of people are not doing. They'll remember to walk and they'll remember to get their steps in, but they're not doing weight training, strength training. And you do need to do that, especially if you want to try to build that bone density. I feel like walking is good to kind of maybe maintain sometimes, but if you want to build, you either got to get in the gym or you do those weight training exercises at home, hopefully under supervision or, properly, because you do not want to also throw out your back or, just or you don't want to affect your shoulders because those can take a long time to heal. So you have to use very good form. And that's actually more important in the beginning, especially to use good form rather than just like adding on the weights to it. So yes, I would say that's also very important to do.
Well, so you would recommend that you go and train under someone initially, if possible,
Mhm.
and then you can replicate back home and do the practices regularly. And
Absolutely.
nutrition is the building block, and you need to check that and work on it and use the calculator, which you have mentioned in one of your video, to
Yes.
actually calculate your calcium intake. But in that video, have you talked about how a vegan person can actually take care of his or her calcium requirement?
Yeah, so that's why, you can absolutely get enough, even if you're vegan. And that's why I like the calculator, because when I first did that calculator, I failed it. And it was like I needed to get about 1,000 for my age. I need 1,000 milligrams a day of calcium, right? So if you're postmenopausal, you need about 1,200 milligrams, for example. And I only failed it because I didn't realize certain foods are actually fairly high in calcium. And I never thought about it, but I'm like, I like these foods. I'll eat more of them. That's not an issue. And certainly if you're vegan, there's definitely foods like on there. So when you put in your regimen into that calculator, it'll tell you, hey, you're only getting like 900 milligrams, or you are getting 1,150 milligrams. It's not that bad. You could also get these little caramel chews that are about 500 milligrams of calcium. So it may be that you're going on vacation, you're not doing, the best food, so you can maybe take some supplements during those days also. So it's not all or nothing by any means, but you absolutely can get enough calcium on a vegan diet as well.
Wow. So, any two foods that you want to mention here, which you thought were not aware earlier that they would have that much of calcium, and it's easy to include in your diet?
Absolutely. So I would say chia seeds are really high on my list. Actually have quite a lot of calcium. And not only that, but it's highly absorbable calcium. So you can make a chia pudding, and you can do it even with plant milk if you don't drink regular milk. You want to put it in and make kind of like a pudding with the chia seeds, and you can eat it just like that. The other thing is tofu, especially for your vegan population. Tofu actually has quite a lot of calcium. So I would say those would be my top two foods, but there are so many more. Almonds, they have a lot of calcium as well. So there's a lot of foods that you can eat, whether you're vegan, vegetarian, or anything else.
So thanks a lot, Dr. Neha. It was pleasure talking to you. Thanks a lot for taking us through so many things and letting us know about so many things. And it was quite a insightful session. And we wish to have you back on our podcast once again with some other topic. And so, viewers, all the viewers out there, if you have any question in mind, please leave in the comment box below. I will connect with Dr. Neha and we will try to answer as many of them as you can. And as I said earlier, please go ahead and follow her channel as well, and you can connect to her directly as well. So thanks a lot, Dr. Neha, and thank you everyone. And if in case you haven't subscribed to my channel, then please go ahead and subscribe it. What I have been noticing that maximum viewers, as high as 70% of them, are watching the content regularly, but they haven't subscribed yet. So please go ahead and subscribe it. If you like this podcast, please give it a thumbs up and share it with your friends and family, especially with people over the age of 50. So it was nice, Dr. Neha, once again to have you on the channel. Bye
Thank you
bye.
so much for having me.